Hello viewers, welcome to our FP Live session. Today we have with us Dr. Jayalakshmi TK, consultant pulmonologist at Apollo Hospitals, Navi Mumbai.
Hello viewers.
Today we will talk about Omicron variant. So doctor, my first question is, what is Omicron COVID-19 variant?
So Omicron is this newly detected variant. It was first detected in South Africa, and it shows a lot of mutations at the uh, on the virus at the spike protein and also at the receptor binding protein. So this makes the virus much more easily spread in the human body, and people catch infection much easier. So this is the characteristic of the new Omicron variant.
Doctor, what are the symptoms of Omicron variant?
So the symptoms are similar to the earlier COVID illness, but it presents more with more cough and dry cough, and not so much high fever and not so much of lung involvement. It is seen to be little less serious and causing less admissions. Its presence more like a common cold is what is seen and what the preliminary report suggests.
Doctor, how India is responding to this Omicron?
India has responded very sharply to the co-micron variant because we had a very bad experience with the Delta variant earlier. So, prompt response has been made in terms of starting RT-PCR testing prior to travel, quarantining people coming from at-risk countries, and it is good that we have made this kind of proactive response.
Doctor, would existing two vaccines will be enough to tackle this new variant?
At present, it looks like the vaccination does confer a good protection against the Omicron variant, though probably not as much as against the Alpha or the Delta variants. Uh, from the initial group of patients who were admitted in South Africa, most of the cases who were admitted were those who were not vaccinated. Around 80% of those were unvaccinated people. And of those who required oxygen, only a very small percentage who required oxygen were vaccinated. So one of them was a patient with COPD who would have required oxygen anyway. So it looks like as if the vaccination does protect against serious cases of Omicron.
Doctor, does Omicron reinfect people who have previously had COVID-19
It
infection?
can technically reinfect people who have got vaccination as well as those who have got previous infection. Although previous infection and vaccination will give some amount of resistance, but it may not give 100% resistance because of the mutations on the spike protein.
Doctor, are children at the risk of getting infected
Children
with
were
this?
always at risk of getting infected with COVID. They will be at risk of getting infected even with Omicron. And with the opening up and of schools and colleges and play areas, they will be definitely at a risk of getting infected.
Doctor, would there be a need of booster dose after the two doses of vaccination?
So the question of booster is yet not very clear. The answer is yet not very clear. It does seem that there is a reduction in the antibody levels in our blood after few months after the vaccination, but there is different types of immunity in our body once we get a vaccination. One is the antibody mediated, which we can measure with some blood test. The other is a T cell mediated, which cannot be measured with blood test. So this immunity is presumed to stay in the body for a longer time, thus giving some amount of protection. How soon the booster is actually required, we don't know. Some of the Western countries have started giving booster for after 6 months or 9 months after vaccination. uh, Maybe we will need to tweak the original vaccine to cover the new variant as well, and then give those either as a booster or as a revaccination or as an annual or biannual vaccination, as the case may be. We will come to know as time goes.
Doctor, what are the precautions can be taken to protect against Omicron?
So the precautions are the same, that is masking, social distancing, and being careful not to go in crowded places, to avoid unnecessary travel, hand washing, sanitization. We have to continue to use these precautions and maybe step up a bit because of this new variant, which is definitely a threat. It is faster spreading the infection can spread very fast among people. It is likely to be the major variant in the whole global population within a short time, the way it is spreading in South Africa and UK, as we have seen. So we need to take these precautions, and we need to be careful for a little longer time. I know that people are experiencing COVID fatigue. People don't even want to hear about this new variant and don't want to think about any social distancing or anything at this time. But it will be well if we could continue to be careful for some more time till this variant is assessed and till the risk is known, and till we know that it is something which is safe and we don't have to worry about it.
Thank you so much, doctor, for giving us a brief session about the Omicron variant.
Thank you very much, and stay safe.